All right, if everyone's ready, we'll go ahead and get started with the regular scheduled Housing and Homeless Committee meeting. Okay, so let's start with member introductions in the room.
Karen Bronga.
Scott Myers.
Randy Solt. Okay, let's start with.
Jessica Parks, Anchorage Coalition Homelessness.
Thank you. And then on the phone, members on the phone.
Chris Constant here.
George Martinez here.
And Mark Littlefield.
Okay, Chris Constance, George Martinez, and Mark Littlefield. Thank you. And we are joined by Michael.
Thank you, Mike Braniff, Parks and Recreation Director.
All right, thank you. Appreciate that. Introductions done. Okay, moving over to the Anchored Home Strategic Plan, one of our plans, and I'll turn it over to Jessica for a quick dashboard review and update.
All right. Thank you so much. Jessica Parks, Anchorage Coalition and Homelessness, and I'm really excited to be able to share some information with you all about the data that's available on our dashboards and linked on our website, and how you can check this in the interim timeframes. As I've shared before, Anchored Home has benchmarks for check-ins every 6 months. So you'll hear from me more in depth every 6 months, and you'll see this particular dashboard updated at that time. But there's some places where you can track some of this data month over month. And so I'm going to share some of that here. So this is our Anchored Home dashboard here. You can see at the top we have the key metrics and then the individual strategic focus areas and their individual goals. I'm going to actually just click through them here. So you can see housing, supportive housing, and supportive services. These are all of the metrics and the updates from the last 6-month update, which was January through June of this year. So this will stay static until early next year when we update it. But this is where you can see all of those goals through Anchored Home and the progress being made on each one of them. And then across the top here, just the different strategic focus areas. So flipping over, and I'm just going to show you these in each individual tab, but I'll show you at the top how you would navigate to these. So on our Anchorage Coalition and Homelessness website, under our work, we have a section called Data Management. And on this page, you can see links to our Built for Zero dashboards, which track the counts of the individuals that are actively experiencing homelessness through our HMIS data. And this Built for Zero data tracks inflow and outflow across all of our different subpopulations. So veterans, families, single adults, transition age youth, and so forth. Our demographics dashboard shows the demographics of individuals in Alaska that are served through HMIS. And so it breaks it down using race, age, project type, other information there. And then the last dashboard is our point in time count dashboard. And this is only updated once per year. We do one point in time count per year. But this has some information based on that point in time count and the data that's collected there. So the first thing I'm going to point to is our data snapshot. This is a one-page really look at what we are seeing here in Anchorage. And so you'll see, I just did this morning. We do have an August 31st update, which is 2,457. So that's going to be a number you're going to hear probably for about the next 30 days when we talk about the active number of people experiencing homelessness. And then I want to look at the inflow and outflow. So inflow are people coming into our system, and then outflow is people exiting our system. And so I am really excited to share that the trend is continuing. So we now have had 9 consecutive months of outflow exceeding inflow. You can see in August it got real close, but it still exceeded it. So we are continuing to see the trend of that number of people experiencing homelessness going down every month. We do have some definitions here of what each of those data points means. And then these are still July's. I have not updated these yet, but we do also track when we have exits from homelessness. Were those exits to permanent housing? Were they to a stay with family and friends? Or were they to another destination like an institution? We track the racial demographics of the people experiencing homelessness and compare that to our 2020 Department of Labor numbers. So you can see here from this chart that we continue to see an overrepresentation of people who are Alaska Native, American Indian, or Indigenous, along with Black, African American or African, and Native Hawaiian or Pacific Islander. Those are 3 populations that are overrepresented in our system. And then the last chart shows us the services used. And so we're able to see out of all of the services people are accessing in our system month over month, how are those breaking down? So are they accessing street outreach? Are they accessing emergency shelter, coordinated entry? What are those resources? And a flip over to our the other dashboards here. And this is very high level. I'm happy to give a more in-depth training for anyone who wants more information. Our Built for Zero dashboards, as I said, that tracks the overall number of people. You can see we have subpopulation tabs here for all individuals, chronic, so people who are experiencing chronic homelessness, single adults, which would be a representation of single adults 25 and up, because we do have a population called unaccompanied youth or transition age youth, which is up to that age of 25. Veterans, a subpopulation of chronic veterans, so veterans who are also experiencing chronic homelessness. And then down here at the bottom, we have families, which are broken into 2 numbers, the family households. So that would be the actual number of family households experiencing homelessness, and then clients and families, which are the total number of people in those families. So just to show you what one of those looks like, this is the all individuals dashboard. Up here at the top is a line chart. It's going to refresh because I disconnected from the internet. A line chart that shows the active at the end of the month. So that's this number here at the top, which you can see it has been steadily decreasing. And then down here at the bottom, it will show you each of those individual number or data points there. So we can see the active at the end of the month, total inflow. That inflow is broken down between people who are new to our system, people who are returning from housing, and people who are returning from inactivity. And then outflow, we see that same breakdown, outflow to housing and outflow due to inactivity. So that's a way that you can track month over month those numbers. And at the top, we'll show an average. So you can see how that particular month compared to the average. This dashboard is the demographics dashboard. So this dashboard will show you over a period of time, which I have it just showing a 12-month period, the last 12-month period we have data for. And you can see here, we have an unduplicated count of people experiencing homelessness throughout that period. So in that 12-month period, we had 7,913 unique individuals access services through our HPRS. You can see the breakdown right below that shows by project type. So which project were they interacting with? And then down below here, the demographics showing the number that were veterans, their age at the project entry, the race and ethnicity breakdown, the gender breakdown, and then down here at the bottom, the breakdown between chronic and not chronic, whether or not there was a self-reported disabling condition, and then the history of domestic violence. And those are all numbers that I'll give you a quick little sneak peek here that's pretty cool. If you click on one of them, so let's say, for example, I just wanted to look at people who were aged 65 and up, what it does is it adjusts all the rest of these numbers to match that. So now I'm only looking at that population of the 775 people that were over the age of 65 that had that interaction. So these are pretty cool dashboards. You can see then that when I look at that older population, the disabling condition increased dramatically from being around half to now being 67% of the people who are over age 65 also have one or more disabling conditions. And then this last one is our point in time dashboard. So this one shows us across the top here on the internet. Uh, our point in time summary year over year. You can see over here, this is a statewide dashboard. So if I only want to see Anchorage, I'm going to uncheck the box that says AKBOS. That means balance of state. So we're only looking at Anchorage. And so here's where you can see our point in time counts over the years. Across the top here, you can see the breakdown between project type, household type, demographics. So this is going to be those age and racial demographics again. The number of people in our point in time count that were experiencing chronic homelessness. So you can see that that is decreasing. And then those various subpopulations here as well. So veteran homelessness, you can see there was a spike in our point in time count in 2022, but then we've been seeing some decreases and leveling off since then. The last piece of data I wanted to share isn't one of our dashboards, but I think this is really important to the work that the coalition is doing and the work that is happening in partnership with other organizations and the municipality administration. And that's our street outreach. So you may have seen this before. This is the map where people can report encampments, and then the tracking of the Parks and Rec team coming in and doing their cleanup, the tracking of the abatements that have been posted or are currently in progress. And this new addition, you can see these kind of bluish, purplish, I've been calling them starbursts on the screen. We just started this in the past couple weeks, but this is where we can track the street outreach visits. So the coalition team street outreach visits and the Hope team street outreach visits are tracked here, and you're able to actually click on one of those and you can see when did that visit happen and who was it. So you can see this one was me an hour ago, adding that particular camp visit from yesterday. So this is something that I'm really excited over the next couple months to really flesh out, and you'll be able to see that on an ongoing basis when those visits are happening so that we can close some of those feedback loops. Because right now, I know there's a feeling that you report a camp and then you don't necessarily see anything happen. So this is where you can see that that report resulted in outreach going out, sometimes multiple times out to that encampment, and that that engagement is happening and that cleanup is happening. So you can see that information. And this is hosted out on the Muni website. There's a whole section on camp abatement there. All right.
Great. I really appreciate that. So as we try to make more database decisions, this will be important. Public can look at it. I think it's a great dashboard as far as you show that the data can be sliced and you can dive into it fairly easily. So any questions from members? Ms. Braga?
I just had a comment. I really appreciate this dashboard. That's one of the main comments that I get from my constituents, that they feel like they put this in over and over and that nothing happens. So it will be nice for them to see that there was outreach. So thank you so much.
Good.
I just wanted to, if I could, share a story. This is, I think, a really good highlight of this partnership that is existing with Street Outreach. The Hope team a few weeks ago had encountered someone who was experiencing homelessness. They were camping in a business park. They had the conversation with them, whether or not they'd had a coordinated entry assessment, connected with us, made that connection to us. That person came down. We identified they had housing assistance. They had voucher assistance available to them. They have a service animal, so that had been challenging for them in the past accessing housing. We were able to find them a unit. They went and viewed the unit last week along with some members of the MIT team. that unit was accepted by him, he was accepted by the unit, and now we're working on getting the move-in set up, and they're cleaning the unit, getting it rent ready, and he's moving in next week. So that was a connection that may have taken much longer if we weren't having those conversations and that coordination for them to be able to say, hey, we found this person, he needs this assessment, let's send him down to your office. We were able to make all of those connections, and that was really nice.
Member Brawley?
Yeah, thank you. I have a couple of questions. One of them is, this is also something maybe for the city to answer after this. I know we're in this presentation. One is, generally speaking, how many camps or how common is it to see camps that are basically abandoned? Like there's no one living there, but there's still stuff there. That's my first question. I have a second question that's separate.
It's fairly common. Usually the report gives us some indication of that. So in the report itself, when someone makes that report, they have the option. I clicked on a cleaning. That shows you the cleaning. Zoom in a little. So when you make the report, you have the ability to say, try to get right on one. You have the ability to say whether or not it is an abandoned camp that is trash only, or the number of structures. It has 1 to 5, 5 to 10, and 10 plus, I believe. So often we know that we're likely about to just encounter a bunch of trash, and we just confirm it. But in terms of camps that are reported, and then when we get there, they are just trash or abandoned camps, 25% of the time, maybe. The faster we get to the camp, the less likely that is to be the case, but it does happen. And then that's what's nice about having this ability to put our outreach site visits in there, is we're able to say that. We're able to say that was trash only. And then the Parks and Rec team can see that. The Hope team can see it, so they don't go out there and try to visit as well. So it's a really good communication tool.
Thanks. Yeah, and that kind of leads into my other question, because I think a lot of the conversations I have had or heard other folks have is that it feels like two things are true at once. One is what you guys are saying, and I think it is true that the numbers are going down, that it is significantly better than it was last year. The number of people, right? We just know this, the number of people going into housing or being in our shelter that's still operating, unlike last summer. But also I think people feel like it is worse, and so I'm trying to square those two things, because I think people's perception is reality to some extent, but it's not matching up to what the actual story is. And so I wondered if part of it is the fact that there's these abandoned camps, and so we see the footprint of people experiencing homelessness, but it's not people still living there. So it's maybe like 3 different locations, but there's only people in one of them, right? So that contributes to the idea that everybody's everywhere. And then also, just I think it's either in people's faces more, or it's just the fact that it is dispersed, and so you've got more impacts in more places. So I just wonder, so it's a question to the coalition and then later to the city as well, kind of how do we square these two things, the numbers that we're actually seeing and then what people experience in the community? Thanks.
Yeah, and I think I agree with you. I think it's a lot of what you said there. I think we are seeing people more dispersed. Last summer, if you think about what unsheltered homelessness looked like here in Anchorage, we had large camps down at 3rd Avenue. We had a large camp at the archive site by Lusac Library and by Cuddy Park. And then we had a large encampment at Davis Park. And then there were people scattered throughout that. Last summer, there were many more people outdoors than there are this summer. But by having those 3 large encampments, that was over half of the people who were outside were in one of those 3 locations. So we are seeing it a little bit more dispersed this summer as well. The other thing I'd want to highlight is that not everybody who is outside on a sidewalk is experiencing homelessness. Our street outreach teams frequently encounter people who do have housing, and they are just outside. They are in the park. They are hanging out outside. So I think that that's important to note as well, that there's just a lot of people outside, and people experiencing homelessness are part of that.
Thank you. And I'll just tie onto that how do we tell people a different story. It's the data. We're going to focus on the data. And the hard part, I imagine, is getting accurate data. So thank you. Anything else? Oh, Karen or Ms. Braga.
Thanks so much. I was looking at your yellow flower spots on the map the other day, and there's 2,640 hours of cleaning up many times in that Davis Park area. Do you have a number of hours that have been spent cleaning up these camps? And to me, I'm thinking, I know that the message has been it's costly and maybe a liability to designate places, but to designate and have dumpsters, to me, if you look at the hours that are being spent cleaning these camps, probably it would be a wash, and a lot of people would be more satisfied if there were spots that were identified. I know that went on and on, sorry.
No, that's okay. And I think that might be a better question for Mr. Braniff next door. But yes, I think that we have seen successes where there are dumpsters and or porta potties available nearby. When we do see camps that do have trash cans available, we do distribute trash bags when our street outreach teams go out. And so cleanliness does get a little bit easier in that way. But in terms of addressing the number of hours and what that might correlate in terms of dollars, that's on you.
Let's see, Member Bronga, thank you for the question. I think it's a good question. I think that when we provide dumpsters and other amenities at camps, we see cleaner camps and better outcomes. I think that there's some challenges that go with that. It's not identified in anybody's budget in terms of who pays for those amenities, and it's kind of been kicked around for us and the health department, and we really haven't arrived at an answer. I think it does save labor hours. We also get other feedback from the community, and these issues get complicated when porta potties are provided, hand washing stations, dumpsters. Are these camps being sanctioned? Is there any public process that, how was that decided? I think for us, the Parks and Rec Department, when we've been asked by the administration or others to provide those amenities that we have, but there's a lot of derivative questions that get opened up. So,
Do you have a dollar amount on the year of cleaning camps?
I don't right now, but I can get you one, and I'd be happy to do that. Yeah, sure.
Okay, thank you. Appreciate it. So next, excited, as you saw from the data, we have a large portion of our homeless population that's Alaska Native, and we have, I believe, A and THC here to give us a simple overview of their system and program. So Jennifer, probably right there.
Right. Hello, my name is Jennifer Summers, and although I'm here representing the Alaska Native Tribal Health Consortium, I do want to preface, we are a large organization. There are several individuals that could be present here today, could be an opportunity to share with, and I think hopefully I just lend some perspective of possible other partnerships within our entire organization. But to begin, I just wanted to, in some of the conversations leading up to this, it was just discussing where does ANTHC have a place in some of these conversations, and what does this look like? And so I think it's important to take a step back and just even think about what the organization does and what it looks like. So again, my name is Jennifer Summers. I actually oversee our substance misuse prevention program. It is one program of very many programs and many health services within our organization. And to give a little bit of perspective, the Alaska Native Health Consortium, it's a non-tribal or nonprofit tribal health organization. We serve people all throughout the state. So really we're looking at 180,000 Alaska Native, American Indian, tribal enrolled members. And we're looking at then trying to provide that outreach all across the state. It's not just Anchorage, it's all of our rural communities as well. We are the second largest employer in the state. And so we have over about 3,000 employees that provide those services across the state. And really, again, our main mission is to provide quality health services in partnership, not only with our people, but then also our Alaska tribal healthcare system. Next slide. For those that don't know, the state is mapped out. And I think that this is really important to recognize because we've got some different public health regions, but we've also got then tribal health regions. We've got 12 major tribal health regions throughout the state, and they oversee and work with many of our communities within each of those regions. In the Anchorage and Mat-Su area specifically, that's where you see South Central Foundation. So the efforts that then, and I think it's important to note too, if you come onto our campus, so the Alaska Native Medical Center, you might be in a building and you might be accessing services through ANTHC. You might also be accessing services through South Central Foundation. And so it's oftentimes pretty seamless from an outsider looking in, but it is representative of then this area. And so again, my job is to connect with all of these tribal health regions and all of these communities to then try to reach out. So where does our program sit within this? And I think it's important to just note this because, again, we are a large system. When you look at the entire Alaska Native Tribal Health Consortium, it's broken down into these 4 units, again, to serve statewide efforts. So you've got the Alaska Native Medical Center located here in Anchorage. You've got the department that then I sit in, which is our community health services. We've also got environmental health and engineering, and then you've got our business support services. So when we look at this, it's really important to understand just some of the differences with what that looks like. Next slide. Our community health services is specifically, it's comprised of 8 different departments. Next slide. This might be really small, but there's 8 different departments that then, again, provide these statewide efforts. And so you see programs such as our epidemiology center, where it's looking at data and how we can represent, the people that we're serving across the state. We look at behavioral health services. We've got our behavioral health aid program, and that serves within communities all across the state, as well as our community health aid program. Distant learning network. This is where oftentimes we're partnering to try to think about the education and outreach efforts across many platforms within the state. We've got oral health promotion. We've got research services. So how do we take the efforts that we're doing and actually put it into practice and research and be able to then know that then it's evidence-based. And then you've got my department. So we've got wellness and prevention. Next slide. Within wellness and prevention, we've got then a number of different programs, and that's where you'll see the breakdown. We've got 8 specific programs. And so you'll see that we've got substance misuse prevention, and even separate from that, we've got tobacco prevention. We've got then programs like our food distribution on Indian reservations. So it's an alternative to our food stamps program here within the state. You've got HIV, STD prevention. We've got injury prevention, elders and outreach, as well as then health promotion and immunization. We do a lot of then statewide work, and this oftentimes comes down to grants that then bring us to specific communities with very specific goals and objectives of how we're going to go and work with the communities themselves and provide those efforts. It's also then very topic specific. So, in my program right now, we oversee a few different grants that are specific to opioids. It lends this opportunity, though, to then really approach harm reduction from a comprehensive level when we're trying to then look at the partnerships that we have to make that happen. So next slide. It's important to note too, our efforts are guided by the statewide data, right? We're trying to then work with the state of Alaska. ANTHC is a partner and it's split within the state of Alaska where we're looking at healthy Alaskans, we're gathering data, we're trying to make evidence-based decisions with our tribal partners throughout the state and really then to influence the efforts that we're doing. Next slide. But specifically, and this is where it becomes a little bit tricky with data driving some of our efforts because it is difficult, as we just heard, to get accurate data, statewide data, local level data to really represent what's going on. In our program, our philosophy, our approach is really a harm reduction lens. And so if you look at this, our goals and objectives are meeting people where they're at. And it's really important to note that it's not a sobriety or bust. It really is trying to make sure that then we're identifying all of the individual's needs, understand where they're at, and that's where housing can become a part of it. But we start to take a different lens where we say our goals are not to decrease necessarily substance use within the state. It's about how can we prevent people from dying? How can we prevent people from using safer or having safer methods of use to decrease things like infectious disease, decrease maybe harms that are associated with it? So a lot of the work that I do is really trying to then think about the educational efforts. How do we make sure that people understand our goal isn't just about reducing substance use, it's also some of these other areas. By approaching our outreach efforts that way, you can create opportunities to talk about treatment options, talk about recovery options. You open the door to a lot more support to meet people exactly where they're at. Next slide. I think it's also important to note we take an Indigenous lens at how that operates too. That's where it's really important to think about cultural safety, sovereignty, and so we're thinking about a non-interference teach us approach, right? We're also thinking about it's not necessarily always recovery, it's thinking about reclamation, and we really want to make sure that then we're looking at how colonialism and some of the efforts, some of the things that have impacted Alaska Natives have uprooted and distorted some of the ways that then they've been able to live their lives. So specific efforts and specific examples of what this looks like though, and I think this is more of where then I come into play with just maybe answering questions, connecting with some different services, connecting with education. Our specific outreach and strategies look like a number of different things. So we focus on outreach, training members of the community, as well as then organizations across the state, always advocating to provide overdose prevention and advocacy. And then we're constantly promoting hope and healing. So what this looks like though is we've got a number of different resources that provide harm reduction supplies, harm reduction education. We do a lot of training and work with programs specifically like Project Hope. We supply a number of different naloxone kits across the state. A lot of training efforts so communities and organizations can know how to recognize and respond to an opioid overdose. Next slide. I'll show one example because one of our efforts has been to really work hand in hand with SALA and the outreach efforts here in Anchorage to connect some of the supplies that we have. But it's worth mentioning, and I wouldn't want to leave without putting this plug in today. Anyone at any point can go on our website and order these supplies, order this education, take part in some of the then training opportunities that we have, because we really do want this to then be focused on reaching out to the communities all across the state. So I Know Mine was originally started because it was I Know My Status, and it was about sexual wellness. And as you can see with the tabs, there's a number of different ways that you can tap into the education to understand about sexual wellness. But it also starts to overlap with harm reduction. And so you can tap into some of the education around, how do substances affect us? What are approaches? How can we be mindful of language and decrease stigma when we're addressing substance use? But the top corner, if you see where it says order resources, next slide, will take you to this landing page. We have everything on there from safe medication disposal systems, so bags, and this is really important when we're looking at then trying to decrease the impact on maybe the environment, access for youth, access for even, say, pets in the home. So these are disposable bags similar to what Project Hope has available. And we will mail these supplies directly to people's doorsteps. And it's free, it's discreet. It's really important to make sure that then we're getting these supplies in the hands of those that need it most. We've got overdose response kits, we've got harm reduction kits. We've started to increase some of the supplies like fentanyl test strips, xylazine test strips. There's a number of different educational opportunities. So maybe there's classroom activities and curriculums that teachers are trying to explore within their communities. Maybe there's specific handouts or posters that they'd like to then put within their organizations as well. Next slide. This is just a breakdown. We try to mimic some of the efforts that then, or the exact efforts that Project Hope is doing. You might see different bags as such with Project Hope as well, but we, in our Narcan kits or our naloxone kits, we put 2 doses of naloxone. We put instructions. We do face masks. We have fentanyl test strips and now xylazine test strips. But this is a perfect example of where it's also an opportunity to connect with resources. We're constantly trying to think about different ways of being able to connect with resources on our own campus, resources within the community. So I'll put this plug in. If there's any organizations that would like to then partner and to try to think about getting more information and more resources out there, please contact me. Next slide. We have, like I said, an online opioid overdose recognition and response training. So if you're receiving a kit under the standing order, it means you need to be trained to know how to then respond, how to administer that naloxone. You can go on here and it takes about 10 minutes to then do that. Once you take it once, you're in our system and we can send you naloxone for free. Again, a few more supplies to address some of the things that we've seen with, for example, xylazine. We've got wound care kits. We're also then working with a lot of our syringe access programs across the state to think about the ways that people are using substances. So, for example, I think next slide. That's the xylazine or the fentanyl and xylazine test strips. Next slide after that. Right now on our website, we have our harm reduction kits. These have syringes, these have cookers, tourniquets, all the supplies needed for intravenous drug use. We're exploring other options though, and trying to think about most of the time, or we're seeing an increase that people are utilizing drugs by smoking them. We want to make sure that then we're still looking at, again, those outcomes of being able to then address how do we lower infectious disease? How do we lower some of the consequences associated with that or harms? And so looking at then adding some additional supplies on there. This is just, again, another example. It's worth mentioning because this again is also about sexual health and wellness. We have things like condoms for organizations as well as personal condom orders, HIV self-test kits, our STI self-test kits, and a number of other things. So these are just a lot of examples. Next slide, I think it's almost the end. Yep. Might be my contact information. These are just some examples of some of the products and some of the materials working with, like I said, the street outreach team. We're constantly providing supplies, and we're constantly trying to think about ways that we can connect our services with the community. Again, to go back, I'm a small portion. We're a healthcare system. It's about trying to then make sure that we're constantly connecting to the behavioral health services that we have, to some of the then healthcare services that we have. There's also a lot of individuals that are doing a lot of great work within the community to expand treatment options, expand that crisis stabilization option and our ER. So I can't speak to those, but I'm happy to talk about some of our harm reduction efforts.
Great. I'll say thank you first for what a great overview of the system and organization. And my hope is that we integrate and work better with you in the future. I'm not saying we haven't in the past, but
Yeah.
And I'm blown away by the resources you have to offer. So
Great. Thank you.
with that, I'll turn any questions from members. Yep, Ms. Braga.
I imagine someone has reached out to you, but my constituents are so thankful for your smoke-free campus, but people go right onto the bike trail by University Lake and smoke there instead. And I was hoping that at some time we can figure out how to fix that.
Yeah, smoke and tobacco-free policy work is always fun. You know, having maybe an individual that's straddling the sidewalk where it's our property, city property, UAA's property, it becomes really difficult. So there are committees that come together to talk about some of those challenges, continue to work on solutions, because it's that entire university district that then comes together and works on what that looks like, you know, outreach, education, signage, things like that.
Thank you. And I'll ask, since you're here, if you had the magic wand, since you have the assembly here, you have the administration, AHD, Parks and Rec, is there anything that you could ask from us or that we could do better to help you?
That's a great question. I would, first and foremost, I think some of these conversations become really difficult because harm reduction is a tricky topic. And again, oftentimes in the outreach efforts that we do, it's seen as enabling, or at least that's the initial thought process. And I think it's really, really critical for people to understand and get to know individuals on an individual level and understand sometimes, and as a person with lived experience myself, sometimes substance use is about trying to survive. So I think first and foremost, it's being able to then open our minds and think about, are individuals open to more harm reduction strategies within the community? If so, what would that funding look like? It's incredibly difficult to get unrestricted funds to pay for some of these supplies. So federal funds do not pay for this. You know, it's really difficult to try to put this together. And even though you see a number of these resources, it fluctuates on what we can have available. And again, to meet the needs of now seeing that most individuals are smoking fentanyl, we need to be able to then provide those supplies to address that. I think it's also really important to bring these conversations from the get-go, right? Again, I'm one of many people that then could be representing THC, and I think having more people at the table, being able to have these conversations and explore how do we really connect, because it's about that case management. Going out and being with the street team and you see firsthand, it isn't just like, hi, nice to meet you. Would you like to go to treatment? That's not what this looks like. It really is getting to know individuals, getting to know their needs, housing, shelter, safety, exploring what their recovery steps look like. So I think first and foremost, being open to understanding harm reduction and all aspects of recovery pathways. Secondly, funding to then support that. And third, I think continued outreach to then bringing others to the table because it is such a large healthcare system.
Great.
I don't know if that's a question, but it's a
I
recommendation.
really appreciate that.
Yeah.
Anything else, members? Okay. Thank you very much.
Yeah.
Really appreciate it.
Thank you.
So next we'll go to the administration. So Ms. Brown.
Good afternoon. My name is Farina Brown, and I am the Special Assistant to the Mayor on Homelessness and Health. And I will be presenting our homelessness strategy that will take us through the next 12 months. So what I will not do is read through the document verbatim because all of you can read. So if you've not picked up a copy, there are copies of the strategy that are on the table. I am extremely pleased to say that our strategy is not 30 pages. If any of you are on our COC call, I think I scared a bunch of people and I said, I don't know, an hour, if an hour is enough to go through our 30 pages. But what we really try to do is listen to the assembly, listen to the community, and recognize that we have a number of strategies, reports, and data that does not lend itself to the administration reinventing the wheel. So what we've truly tried to do is to make sure that we have taken action steps and strategies in this document from the existing information that was available. So as you scroll down on this page, what you'll see on our front page are the 4 steps that we are following and that will be our flow from our first 100 days through 12 months. And that is going to be to significantly reduce unsheltered homelessness through low barrier shelter and connections to housing, increase access to behavioral health and physical health care, add new housing and increase access to existing housing, and harness community partnerships, funding, and data to reduce systemic contributors to homelessness. Further down, you will see the different strategic plans that really help to inform the framework that's in front of you. I want to echo something that Jennifer said in her presentation. The administration really views the lens of how we address homelessness, which is complex and systemic, from a public health lens, which is focused on harm reduction and prevention. And understanding that that is a very different view of how we approach things. We intend to make incremental change through partnership and through collaboration. For the sake of time, I'm going to jump down to action and results so that we can then pop over to the next page where we'll do a little bit of a deeper dive. When we think about the administration's actions over time, key components of our strategy include creating adequate year-round shelter and transitional housing, establishing reliable navigation, rental support, and services for people moving from shelter to housing, improve access to behavioral health services and physical health care, reduce racial disparities in access to shelter and housing. I am disheartened but happy that Jessica was here to present the data from the coalition that really demonstrates the disparity that we see within our community for the individuals that are experiencing homelessness. And it is the administration, and I'm really pleased to be able to say this, that the administration recognizes that. And through partnership and collaboration, we want to ensure it is a part of how we move forward in making that incremental change, understanding that there's not one right-sized solution, that we have to have multiple different solutions, and the lens with which we look at establishing those solutions have to ensure that we're looking at equity. Results. After 3 years, success in Anchorage will mean significant reductions in unsheltered homelessness, fewer families experiencing homelessness, higher quality of life and business confidence citywide. All Anchorage residents have equitable access to health and safety. What you won't find in this document are immediate metrics. That is a part of what our collaboration looks like. It is not the intent of the administration to say, and we will do this, because that is not generating a sense of mutual accountability and shared responsibility. The work and the complexity of homelessness requires us to partner, and creating those outcomes and adhering to milestones to reach those outcomes requires partnership. So this is a living document, and you will hear me speak to it in multiple different iterations and different groups so that we are establishing shared outcomes that are driven by our community that will also hold the administration responsible, along with our partners, on how do we reach those milestones. We will scroll down and then we'll get to the good stuff. All right, in the first 100 days, today is day 80. So in our first 80 days of the 100 days, I am incredibly proud to introduce Lieutenant Brian Fuchs, who is the supervisor for the HOPE team, which launched about 45 days ago, but it had its official launch today. And the HOPE team consists of a sworn officer as well as a social work navigator that participates and is specifically dedicated to engaging in outreach with individuals that are experiencing homelessness. That team, in collaboration with the coalition, creates a more robust outreach engagement. I know all of you in this room have heard from constituents and are those individuals' constituents that have talked about the safety within our camps. Having a sworn officer as well as a social work navigator creates bandwidth and proactive engagement that most people aren't willing to engage in criminal activity when you have a cop around. So there's that. And then you have a social worker who can really help to link people to resources. Recognizing that not everyone is immediately ready for services, the HOPE team has the ability to continue to do that outreach, understanding that multiple contacts are often necessary, and being able to provide that linkage. Jessica, again, provided some great information about what that partnership looks like. I'm like, man, I feel like I should slip her a 20. Like I wasn't prepared for that. So it was really great because it was just this, it demonstrates how organic this relationship has been. I do want to give Lieutenant Fuchs an opportunity just to introduce himself and speak a little bit about the HOPE team.
Yeah, good afternoon, everyone. My name is Brian Fuchs. I'm a lieutenant with the Anchorage Police Department. I've been with the department for about 17 and a half years. I've spent all of my time on patrol. I've been a patrol officer. I was assigned to the Mountain View area as a beat cop for many years. I spent most of my time in East Anchorage in the downtown area. I was promoted to sergeant about 4 years ago, where I continued that trend as a sergeant of patrol. And I worked the north sector of town. So all of downtown and East Anchorage, Mountain View, those are my areas. Those are my people. And so I really enjoyed that aspect of it. I was promoted recently to lieutenant, and I was given the privilege to command the Hope team, the CAP team, the Intel team, and the MIT team. And so I'm honored and privileged to support this effort and to be a part of the coalition citywide to really get our heads wrapped around what's going on, support both our community at large and the community that's suffering from being unsheltered. Our Hope team is newly formed and is a project that I am really proud of going forward. We are continuing to develop that process as we move forward through lessons learned. We've already had contact with, I think, over 165 people, and we've assisted with the housing of over 18 people in just 45 days. So we're seeing immediate impact and return on our investment. For the community at large, there's a safety aspect that I think that you will see long term. In the short term, it might not be as evident, but I think long term, you're going to see things kind of develop when we start to build positive relationships from the police perspective within these communities, getting access to these communities, talking to these people, understanding their stories, understanding who they are and what their needs really are, and how we can facilitate getting them the resources they need in a timely manner to help them kind of break that cycle of homelessness or substance abuse, connecting resources. We are in a very unique position as police officers. We're somewhat, I'll say it's kind of my punch phrase, if you know me, we're the tip of the spear in this effort. There's no doubt about it. We have a place and in this effort, and we're going to continue to partner with the coalition. And Jessica has been amazing working with her. We're going to continue to partner with the coalition to go out there and provide the city leaders, the city at large, the community with impactful feedback and results in how we can create a safer environment, not only in the camps, because when we have a lot of victims in the camps, and a lot of the community doesn't realize that. A lot of the campers are being victimized by other people and other criminal elements. We want to reduce that. We want people in the camps and people in the community at large to be willing and comfortable to report crimes where they otherwise won't report them to a patrol officer. And so by doing that, that's going to influence and reduce criminal activity in the area by building trust, building relationships with victims, and getting people to report those criminal elements. Then we can then redirect police resources appropriately to deal with those elements in a direct and very kinetic manner.
I do want to just address something head on. It was a question that was relayed to me around the concern with increased law enforcement contact with individuals that are experiencing homelessness. And I think Brian said it as articulately as possible, is that this is a proactive engagement about building relationship. Individuals within camps are often vulnerable and they are victims. And so how do we create a different relationship? Understanding that often law enforcement is the last option for people. They would much rather, how do we keep this internal? How do we resolve this ourselves? When we are not engaging and creating those positive relationships, then the situation escalates for the community and within those camps. And then you have the highest level of engagement. Our role, our goal, and our aim is to really create a different kind of contact. And the start of that is through the use of hope. For the sake of time, I want to tell you what is not in the document. We are spinning up 500 non-congregate scatter site shelter beds. We are still in the confidential process of establishing contracts with vendors for those services, as well as continuation of the 200 congregate beds at 56th Avenue. That shelter continues to run at full capacity. So in anticipation of 450 to 500 individuals that will seek shelter during the winter, we will have tentatively between October 15th and October 23rd, our scatter site non-congregate shelter beds available. So I just want to level set that. We will also be working with the coalition to prioritize getting individuals into non-congregate in a very coordinated process to ensure that vulnerable folks are getting through the door. The other element of our congregate and non-congregate shelter that I want to make sure that I'm saying, because time is short and there's a lot of information here, is that a component of the contracts for both congregate and non-congregate includes case management. It is absolutely critical to ensure that we have case management and navigation so that individuals can move through the continuum. And moving through the continuum can mean connection to treatment services. It can mean connection to family. It can literally mean, help with resume and employment, because everyone is at a different point when they are engaging in shelter services. And that is where the linkage and navigation piece are absolutely essential to ensure that we're creating flow in the system. I also want to acknowledge that we recognize, and throughout this document, you will see us talk about the need to stand up more housing, permanent supportive housing, and housing all levels. We can't create flow in the system if there isn't somewhere for someone to go. We can't do that in the first 100 days, and it is highly unlikely that we'll have a major, set of housing in the first 12 months. I am open to all partners who want to help achieve that in the first 12 months. So let me put that out there, but I do like to be as realistic as possible about expectations. So in the first 100 days, and what you'll see throughout the document, it's color coordinated, and each month is just basically the throughput from the initial objectives that we are working through. So increased outreach to camps before abatement. Abatement will continue. We will continue to prioritize abatement according to Title 15. Right now, we've been very clear that we're looking at camps that are near schools. We have genuinely tried to work with our outreach partners so that they're engaging with those campers to get them to move along. We have utilized, thankfully, thanks to Lieutenant Fuchs, patrol officers as well as APD to work with other campers and vehicles that are parked near schools that make it a little bit more difficult to abate, because those cars can just drive away and then they come back at night. So having those routine patrol and engagements reduces that number. Communities will still see those individuals, but when they're in a vehicle, having that just routine patrol increases the level of safety that we can see for the neighborhood. We'll continue to work with our coalition and other partners to coordinate shelter and housing resources for people moving from camps prioritized by vulnerability, which I spoke to, maintaining the 200 beds and completing the RFP process. Again, as you look through to the next 6 months, that's just the throughput. In the next 6 months, we also recognize the need to identify peer support, transportation, and other navigation partners. It's really important that we talk about transportation. Giving someone just a bus pass is helpful, but how do we have consistent and reliable transportation for someone that is trying to get to employment when there is a need to get someone who may be engaging with Anchorage Safety Patrol, but they actually need somewhere to go because it's cold? How do we get them to the shelter because they don't meet that criteria? So we have a full recognition of the need for transportation in a variety of different ways. You'll also see under the 6-month marker, develop additional low density, under 50 population specific low barrier shelter options. Our initial launch and push is to ensure that we are spinning up those 500 beds for the unsheltered. But recognizing throughout the winter, there's opportunity for smaller, low density, population specific. So that is also something that we will continue to support, as well as ensuring that we have warming shelters starting from November through February. As you look at that throughput line through the first 12 months, you'll see at the top of that list, which is establishing consistent low barrier winter shelter services, which include congregate, non-congregate, and case management, utilization of HMIS data, that's the data that we are partnering with the coalition on, to monitor movement from unsheltered to sheltered, from unsheltered to shelter to housing, and adjusting resources as needed. We are genuinely looking to be data-driven and not making ad hoc solutions. So having partnership, but also really looking at what is the data telling us that has been successful, and then how do we be creative and innovative, but ensuring there's a tie back to how is that actually impacting the people with that intended result. Connecting to peer support and transportation is ongoing. Identifying and launching legal parking sites. So that is something that we have experienced in a very different way this summer, is the number of individuals that are sheltering in their vehicles. And we recognize that we need to have somewhere to direct people that is patrolled, that is safe, and that has outreach partners that are consistently engaging. We believe that having legal parking sites will reduce the number of, well, we'll do two things. We know that there are some individuals that are unsheltered in cars and RVs and other types of transportation that are engaging in criminal activity. We suspect those are the folks that'll be less likely to engage in legal parking, and that helps to identify for the police how to work and engage and create safer community, while those folks that are seeking services are engaging in legal parking and connecting with outreach. I'm going to jump down to health, establishing a quarterly behavioral health provider work group. This is essential. I have been to a number of community partner meetings where there has just been reports of how do we help this person? We don't want to call the police because we know that they're experiencing a behavioral health crisis. For the administration, and you'll see this into the next 6 months, developing an active referral network of behavioral health service providers is fundamentally important to create change in our continuum. It's not just about creating safe places for people to go through congregate and non-congregate shelter, but how many contacts is it going to take before they're ready to engage in treatment, which could be behavioral health or addictions treatment. In doing so, we need to know who those partners are. When that person is ready right now, we have to be able to say, okay, we're going to take you right over to this partner and they're going to be able to get you into services. Assessing the behavioral health beds available in Anchorage. That fluctuates. So it's something we want to ensure, again, when you see that throughput line, that's a part of that ongoing communication and behavioral health network of referrals. If we don't know what's available in our continuum, we can't spin up or spin down based on what that need is. Support the establishment of a care coordination group for the highest utilizers of Anchorage Crisis Collaborative. The Crisis Collaborative is an existing group that was put forward through the Alaska Mental Health Trust Authority that is led by Agnew Beck, which brings together our Crisis Now partners. Adding an ad hoc group of care coordination to that leverages that behavioral health network. And it also allows us to utilize existing groups and partners. You'll see again in that throughput is really recognizing the need to participate and coordinate in our crisis collaboratives from the administration's perspective so that we're engaging with partners and we're getting that real-time feedback. We want to, in the 6-month column, increase connection with primary care and providers serving individuals with complex needs, strengthen collaboration across behavioral health crisis continuum. So you'll see that there's two different types of behavioral health connections. It's one for individuals that are in the need for that initial engagement in services. So that's our behavioral health network. But then there are individuals that are in crisis. And that's where having our mobile crisis team, our mobile intervention team, and fingers crossed, our crisis stabilization units stood up at Providence, and then in the coming year through South Central Foundation, having a place for people to go that's operated by behavioral health professionals that can assist. But also recognizing that in the right now, being able to have good close ties with our mobile crisis team and our mobile intervention team. Those services and that relationship would be ongoing in the next 12 months. Housing. The administration's housing strategy. So developing a housing strategy, and much of this is pulled directly from our anchored home plan, recognizing the need to have permanent supportive housing, coordinating with strategic partners to advocate for federal funds to build affordable housing meeting HUD criteria. We have to do that front end work in advocacy to ensure that we're getting that back end result, because we could do all of the peer navigation and case management supports we want, but we lack housing at all levels. So if we are not being attentive to the entire continuum of need, which is funding for housing so that we can build the back end, then we're not linking people to a sustainable resource. When you look over in the 12-month column, you'll see there's a lot of orange because there's a lot of work that has to happen with housing. We say support and help spur the development of XX number of units. And that is because we are happy to have that community input to say, we want to put forward 50 more permanent supportive housing units. So that is our way of saying, come to the table and let's partner. Data, funding, and coordination. I'm jumping over to the 100 days. Meet and reestablish communication with our Homeless Leadership Council. Connect and coordinate with our community support team. Develop strong relationships with the Assembly Housing and Homelessness Committee, our coalition partners, other safety net organizations. Something I am really excited to see in this, which is convene with our I-team. And so that speaks to, again, Jessica, identifying the need to have that data loop. It is important that not only do we have internal data that helps to drive what we do, but to be responsive to the community when someone identifies a camp, what is it that we've done? And how do we create an automatic feedback loop so people feel heard and they know what action is being taken? Going to jump over to the 6-month column. Establish relationships with advocacy and funding partners. We have the Alaska Healthcare and Hospital Association, Alaska Behavioral Health Association, Alaska Mental Health Trust Authority. Develop relationships with our tribal health organizations throughout Alaska and other business leaders. So I'm really happy to have ANTHC here because that's a very easy relationship for me to start to build at the end of this meeting. But our goal, and you've heard me say this in the first meeting and any other meeting, is co-creating solutions through collaboration and partnership. As a municipality, we own that we need to stand up shelter. We understand the need to have a paradigm that ensures that there's navigation. We understand housing is the ultimate goal, but there's a level of partnership and coordination that has to happen with our community, with the existing organizations that have been standing in this space for years, and new partners who are willing to come to the table. Health, our health goals will continue to be ongoing over the next 12 months, and we will adjust based on resources needed and adding new partners. Data and funding. We will continue to host a series of cross-sector partner meetings that are data-driven. That is our commitment to ensure that everyone has a seat at the table and that we are adjusting as we move forward. That is the plan in a nutshell. There's a lot of just information embedded in here. I'm happy to take questions, and please know it's a living document. So I'm looking for feedback on how we do this as a partnership.
Great, thank you, appreciate it. Member Brawley.
Yeah, thank you. I'll start with, this plan is about 3 years overdue, and not because of you guys. But I really appreciate this. I do have some feedback, and a couple of questions, and I also appreciate I appreciate you guys getting this out, in the community to socialize, and that it's still, as you said, a living document. In terms of sequencing, I do have a couple bits of feedback and would like your, kind of response or thoughts. One is, and then I'll say this and then set it aside because it's not the purpose of this meeting. I think what is known about Title 21, our zoning code, is that it is at this point directly in conflict with all of our housing goals. And so I would say that the urgency on starting to make some of those changes and really things that are gumming up actual projects that will not get built this year should be a high priority. So, and I appreciate that's not, again, the point of this meeting, but I will say that if we don't do some of these things kind of immediately, we will never meet these other goals. But on this particular point, I do question also, and I appreciate this, the safe parking and really outlining, separating out criminal activity that's happening in vehicles versus folks who are living in the vehicles. But I do wonder, because I see that you're saying that that is something that we'll have next summer, but I see that that's a need now. And I just wonder through the winter, where are those folks living in vehicles going to go? Because I think one expectation is some of those folks go to shelter. Other is that people say, don't want to lose their vehicles, or, they will choose to live in those vehicles as a safe place. So that's one thing, is like, is there a way to move that up sooner? And then the other kind of big question on the shelter piece is, I was reflecting back a year ago, working with folks like Director Rash, scrambling to get appropriations in the budget or scrambling to get appropriations approved so that you can actually do the contracting and do all those things. So I know we're not in that mode. I'm certainly not in that mode right now, but I do worry about, do we have enough money to pay for this? And how much of it is the city paying for, and where is that coming from? Because I do know we have over $700,000 for emergency cold weather shelter. I also know the hotels or non-congregate, whatever the non-congregate looks like, is going to cost a lot more than that, especially standing things up by October. So if you could speak a little bit more about kind of the funding strategy, and then also what is the city paying for versus, as you said, partners in the next, between now and the end of the year, basically. Thanks. And I know that was a lot.
That's through the chair, Member Brawley, thank you for the questions. So I'll start with budget. Right now, the administration is working with the chief administrative officer, chief of staff, and OMB to ensure that we have funding through 2024. And you will see in the mayor's budget on October 2nd, a plan for funding through 2025. So there'll be more to come on that. You asked a question about legal parking and where do they go. We, Director Ash and I were just having this conversation yesterday to really ensure that we recognize that people don't want to lose their vehicles and that they are able to park at our congregate and non-congregate sites. What we don't want to encourage are individuals living in their vehicles while they're parked in front of a shelter, because that can create a safety risk. Often you don't know what's happening. And when we're talking about someone that is just potentially parking an RV, that creates a similar, at times, unsafe situation for everyone involved. So that is ongoing conversation to ensure that individuals can bring their vehicles to both the congregate and non-congregate sites, but they should be staying within those shelter spaces. We recognize the need to get legal parking started as quickly as possible. But what we also don't want to do is to have individuals choose to park instead of go inside, because parking can be very unsafe and could be hazardous. And we don't want people freezing to death in a parking lot because they chose to do that instead of going into one of our non-congregate sites.
Thanks. Yeah, and I'll just briefly add, I know we do need shelter. I do have, I guess I just have questions how it will roll out. And I think it also is incumbent on some clear communication with the community about what our realistic options are. And I know that's what you're doing. But of course, we all know the cycle that we've had for several years now is someone puts any idea on the table and then it gets shot down, or people say, don't put it next to me. And so that is just the reality that at some point we have to stop that cycle. And I know you guys are working on that, but I'm saying that to everybody else as well, that like, if we don't like how things are now, we have to do something differently. So thank you for putting this on the table.
Thank you. Member Bronga?
Thank you. I completely echo Anna's, Member Brawley's comments about the safe parking sooner rather than later. The situation is, if we have a snow year like last year and we have vehicles that are parked on right-of-ways, it makes it more difficult to plow. I just am thinking of an example on Boundary Avenue where there's a couple of motorhomes that are living, and you have to, I biked on there, and you have to get into the road to get around those vehicles. They do cause a hazard, and I would love to see a spot identified for them that is going to be a safer situation for neighborhoods. I'm glad you mentioned Title 15. I remember when we were going through passing, these are the areas that are prioritized for abatement. There was conversation about the data sheet that Jessica shared, maybe something like that, a map that shows these are the never allowed spots. And I would love to have it mentioned that when we go into next spring, everyone who leaves a shelter knows that you will not be within 50 yards of a, I don't know the numbers, I'm bad with numbers, but this many feet of a paved major trail, this many feet of from a body of water, this many feet from a school. So it's really clear. This never happens here. And if you're not pointing to where they can go, I'm sure that my neighbors would really appreciate people being very understanding of where they cannot go and they'll get abated. And I know you're just
Yeah.
so compassionate and kind, and I understand why you don't want to just go and root someone out. And then October 15th, we're asking them to go. But if we can be really mindful that this spring, the expectation is out there, I would love that.
Thank you for the feedback.
Thank you. Okay, Member Martinez.
Thank you, Chair. Following along the same general discussion with respect to education, I think Member Bronga just described the education opportunity to tell folks where they couldn't go. That was what I think I heard. But I wanted to follow up along with potentially a suggestion. Ms. Brown, you mentioned the idea of a different type of contact with law enforcement, or at least someone mentioned it earlier in the discussion. And I wonder about the opportunity to have re-education or some suite of code of conduct education with respect to the different type of contact that I think is important that we highlight with respect to community members. So when we hear a lot of the challenges that community members express, constituents express, a lot of those things are like fundamental how to be a neighbor, how to be in community, how to not be destructive to parks. And I recognize that there are physical challenges and many other challenges, but I just wonder about the opportunity to have some education going on with respect to how to create a better contact with respect to communities and folks that might find themselves unhoused within those communities. So I just wanted to flag that. I think there's an opportunity for education. And I would just highlight, the Assembly just passed a resolution describing and advancing trail etiquette as a component of re-educating the general public about how we use trails, because the amount of trail usage has changed from 10, 20 years ago. And so just the idea that there is real re-education that's possible, especially with respect to the different types of contact that people could create a better environment for. So I just wanted to flag that, and thank you, Chair.
You're welcome. Never miss an opportunity to educate. Should be in everything we do. So if there's no more questions, we'll move over to the Anchorage Health Department.
Good afternoon, everyone. Kimberly Rash, Acting Director for the Anchorage Health Department. I have a couple of things that I just want to highlight. One is going to be a reappropriation request from the Anchorage Health Department that should be coming to the body here shortly. And so kind of touching upon funding, current funding that we have. So for August of 24, so last month, we looked at potentially using leftover funds from UAA, and then we reverted to utilizing funding that had already been appropriated to the Anchorage Health Department, which was the Emergency Cold Weather Sheltering Funds, which was a little more than $752,000. So we used those funds. There's still some leftover funds that we are now going to be utilizing for September. What this reappropriation does, it is in the amount of a little over $465,000 from the Anchorage Safety Center Patrol funding through alcohol tax. So in the beginning of 2024, the Assembly appropriated $2 million to Anchorage Safety Center Patrol. $855,000 of that was moved aside for unified funding, which left a little over $1.7 million. The Anchorage Safety Center Patrol contract went into full effect mid-March. And so there was a set of funds that are not going to be utilized from January to that timeframe in the amount of $465,000. So we're hoping to be able to utilize those funds to pay for the congregate shelter for the month of September. So congregate shelter funds include rent, utilities, the operator, and food services at that location. So with the leftover funds from last month and this reappropriation of funds of $465,000 will get us through for September. And the reason why we're asking for this is because while we do know that we have the $4 million, that $4 million isn't necessarily in the account yet for us to hit, so that we can utilize those funds. And we're hoping that we're getting very close so that next month we'll be able to kind of activate those funds. The next item that I want to touch base on is for the solid waste services location. As we know that the Anchorage Health Department has entered into a lease with solid waste services. And so in that lease agreement, it indicates maintenance and repairs. And so AHD is responsible for minor building and ground maintenance, while solid waste services is responsible for all major repairs. So we are going to have to utilize about $35,000 from our operating dollars to do some repairs, which include glass replacement, bathroom repairs, a broken door, repairing a urinal. And so that's just for line of sight of making you all aware that we are going to have to utilize some of those funds. In addition to that, we have put in the request a written notice of our intention to exercise our option to extend that lease until next year. And so that came to the body, I believe, last month. And there was an amendment to that agreement indicating that we would just have to put that in writing to Solid Waste Services. So the acting director of Solid Waste Services, Kelly Toth, has agreed, and we will be moving forward with that extension. And that is all I have for budget right now.
Great, thank you. Any questions? Okay, Ms. Brown, anything else from the group?
I did not get a chance to thank Director Braniff and Director Rash. They are a critical part of the work that I do. And so when I say the administration and the team, that also includes both directors that have been absolutely wonderful in their partnership. And so I just wanted to call that out, as well as the new lieutenant who has just jumped right in.
Great, thank you all for coming. Appreciate it. So that brings us to public comments. Do we have anyone here for public comments? Please come up, state your name, and we'll have 3 minutes.
Ron Oliva, 50-year resident, adjacent property owner to the Brother Francis Shelter. I'm here to give a little summary, which isn't good because I have sent you multiple emails with photographs on 5th and Carlick, 4th and Carlick, 3rd and Carlick, and it just kept growing. And I said it would get worse. It did. Finally got us, besides the fires, the visualization of sexual assault, everything going down. The camp wasn't abated. It led to assault on myself with a knife, and then a customer got assaulted. But then finally a homeless person was executed, and my day laborer was standing next to him. They shot the other guy, emptied the gun in him. It was a gang-related hit, drug deal gone bad, but the bullets fly everywhere, and that's near the Lucky Wishbone. Well, it continues, and it must be something on myself because we had a business on a cabin on 4th Avenue next to the Fur Gallery. And well, you couldn't keep it staffed because there were steps, 2 steps going up into the doors, and they were frequently occupied by the homeless. And the story is garbage, threats, harassing customers. We finally had to close it and then take the building down. And during the time, this past 2 weeks, we were taking it down, the contractor had to get a gun to prevent the theft of his tools. And the final insult came when we finally got the cabin down, stacked up. The industrial cords, the power cords going to the building were hidden under the last remaining deck. $1,200 worth of iron or copper got cut off. So that, and as we sat here, my home is in Rogers Park, adjacent to a wooded area, but they had a homeless fire on Northern Lights in the Value, or what is it, the Village Inn. So it's haunting that this is going across town, but she mentioned, which I was surprised, an instant response when you call in camps, because I've written 123 emails and no answers, especially from Chris, Felix, Dan, and of course, Meg. And so I do want to compliment and commend the Anchorage Police Department, because they get a bad rap to dangerous situations, put themselves in harm's way. And I'm going to bet this guy has a family and is a family man. And that breast protector at night going into these camps, I don't know how they do it. And it brings tears to my eyes that they wear that flak jacket and hope they're going to return home to their families. So this is a crisis, and it's ruined my life to no end, but I'm still willing to assist. I have the facility. We have programs. I'd like to be part of them. But hey, at 73, you never worry about the bullet that has your name on it. It's the one that doesn't.
Thank you, Mr. Oliva. Appreciate it. Anyone else? Please state your name. Thank you.
Jamie Lopez, East Anchorage, formerly Coalition. I go up to camps up to 2 a.m. at night, no flak jacket vest. And I do it regularly. And what I can tell you is Hope Team, probably kind of a good idea on the paper. It's probably not a good idea to take police out with people that you want to build relationships with, because most of the people in these camps, they do not trust police one bit. It's no slight, it's just they don't. And so you're better off just getting people that are building relationships and going out there and doing it regularly on a daily basis, so that you can show that you're not a threat to them, or that something could come back. It's just, I think you have a good idea, but bad implementation. And it's better not to bring police along if you're trying to build relationships. With that said, I think Ms. Brawley and Braga discussed, safe parking. That was passed in April, I think, at that meeting. And yes, if you create places for people to go, then it's not one of these things where it's a scatter shot, where you go ahead and you do an abatement with the abatements RS button over and over and over again, or you're traumatizing people and they actually know, hey, this is a place where I can go. And that's the unfortunate situation. What's been going on is, you had Cuddy at National Archives lot, you abate it. People naturally go 1 block east, and then they, Fairbanks Street grows, and then you do it again, and then they up on 33rd, and so on and so on. You're inducing cycles of trauma on people that are already traumatized. And so somebody's got to pry the abatements or us button back and say, okay, what's our plan? Where's a place for people to go? On top of that, okay. So last year, what you had AR 2023-188S1 for the National Archives slot that came out of like a homeless sanction task force. They promised people free Wi-Fi, free electricity, cold water, sanitation, pallet houses. I joke about everybody getting a free pony too, because that's kind of how it was. And it was the sort of thing where you had to basically say, okay, what's our timeline? You get the adults at the table and you say, okay, what can we get done? Get the engineers in, and you execute, and you do it within 2 to 3 months, and you do it on a phase 1, phase 2, phase 3. Nobody even attempted it. There were things you could have done. You had a NOC, Network Operations Center, right across from Cuddy. You could have done Wi-Fi mesh network at the perimeter. You had a wellhead on that site. You could have had water. You could have had a Quonset hut to provide heat, and none of it was done. And so I was back channeling Jessica here in November saying, look, This is an S show because people can't get in, they can't get out. The lot was not plowed. Emergency services. So ultimately what they ended up doing was removing the security and opening the gate. And then it was a free for all. And so I've been willing to discuss things with people. People have my number approaching me. I see things all the time. And yeah, there are things you can do. But the question is, do you want to know? So, all right.
Thank you. Thank you. Appreciate it. Probably have time for one more.
Hello, I'm Miss Sophia O'Neill, and I'm currently a resident of Eagle River. Been in Alaska for 5 years. You may like to think so. You cannot control or predict your circumstances. Bad times befall us all, and it's only a matter of how we weather them and resources available to us, taught or forgotten, that determines outcomes. Most people live lives actually of quiet desperation. Any position in life can change with your health, with an accident, or any myriad of circumstances. As a human, we are delicate, no matter the exterior. Be grateful for the circumstances that elevate you to a better quality of life. But don't forget nor disdain the powerless, forced to be amongst elements that are against society. Because the reality, it doesn't take much for circumstances to drastically change, where both criminals and their victims are made and forced to coincide. It is up to us to remember that there are those that need us. And if we are in a position that can weather the storms, we must remember, don't ignore the needs or disdain those that need help, or actually heed the call for public service, or those that appear to us unworthy by some all-encompassing projected lack of sense. Analyze realistically the actual fragility of your own circumstances, your outlook, your own projections. You cannot surmise, read minds, or believe that just because you thought of something makes it true or applies to all or any situation. Stop, please, the jumping to conclusions devoid of facts. Rather, participate, discuss, and analyze. Problems don't solve themselves, nor do general labels help, nor the act of deferring problems to others, only to later blame how things are handled when you yourself do not participate, only complain and incite. Participate in finding solutions, void of blame, quick judgment, bias, or agenda. You will see how so much is connected and find the long-term solutions in which you seek. Thank you. Bravo, by the way.
Thank you. And we're adjourned.